Hi everyone, welcome back to the channel. Before we begin, first subscribe to my channel and press the bell notification so that you will not miss any new video. Our today's interview is with a nurse practitioner. In this interview, we'll dive into the challenges, rewards, and responsibilities of being a nurse practitioner. So, sit back, relax, and let's get started with this exciting interview.
Can you tell us about your background and experience as a nurse practitioner?
I've been practicing as a nurse for 5 years, with 3 of those as a nurse practitioner in primary care.
What role do you think nurse practitioners play in promoting preventative care?
Nurse practitioners are vital in educating patients on lifestyle changes, early screening, and risk factor management, which can prevent or reduce the impact of chronic diseases.
What steps do you take when diagnosing a complex case?
I start by gathering a detailed history, conducting a thorough physical exam, and ordering the necessary tests. If needed, I collaborate with specialists to ensure a comprehensive approach.
How would you approach a situation where a patient disagrees with your medical advice?
I would listen to their concerns, provide evidence-based explanations, and work collaboratively to find a solution that aligns with their preferences while maintaining safety.
How do you handle high-pressure situations in a healthcare setting?
I remain calm, prioritize tasks, and collaborate with my team to ensure patient safety and care quality.
Can you share an example of a time you improved patient outcomes?
I worked with a diabetic patient, adjusting their care plan and providing education, which led to significant improvements in their health metrics.
How do you prioritize tasks during a busy shift?
I assess patient needs based on severity and urgency, delegate when appropriate, and ensure timely follow-ups to avoid overlooking critical details.
Can you describe your experience working with electronic health records, EHR systems?
I've worked with several EHR systems and am comfortable navigating them to chart patient information accurately and efficiently.
How do you stay organized with multiple patients and responsibilities?
I use task lists, prioritize by urgency, and maintain clear, concise documentation. I also communicate effectively with my team to ensure seamless care coordination.
What steps do you take when encountering a medical issue that is beyond your expertise?
I refer the patient to the appropriate specialist or resource and ensure timely follow-up to coordinate their care effectively.
Can you describe a situation where you advocated for a patient's needs?
One day, a patient was struggling to access necessary medication due to insurance barriers, so I worked with the pharmacy and insurance company to ensure they received the medication they needed without delay.
How would you handle a situation where there was a mistake in patient care?
I would immediately inform the necessary parties, take responsibility, and work to rectify the situation to prevent any harm. Transparency is key in building trust and improving processes.
How do you handle situations where you need to deliver bad news to a patient or their family?
I approach the conversation with compassion, honesty, and clarity, ensuring that I provide emotional support while also discussing the next steps and available resources.
How do you ensure proper patient education when discharging someone from care?
I take the time to review discharge instructions clearly, answer any questions, provide written materials, and ensure the patient understands follow-up care.
How do you support fellow staff and contribute to team spirit?
I offer help when needed, provide encouragement, and participate in creating a positive, supportive work environment.
After a thorough evaluation, we are pleased to appoint you to the position of nurse practitioner. We believe your experience and commitment to patient care align well with our team. Congratulations!
Thank you for this opportunity.